Good morning all. I am Dr. Pranshul, Bishnoi, Consultant Orthopedics, Joint Replacement and Sports Medicine at Manipal Hospital, Gurgaon. Today I am here to give you a few facts about knee arthroscopy surgery. What is knee arthroscopy? What all conditions require knee arthroscopy surgery? And what are the benefits of arthroscopy surgery, and what are the risks and what are the complications involved, so that you have a view of the procedure. This is a model of the knee joint. This is the kneecap, the thigh bone, the leg bone, and these are the menisci. Menisci are sort of a soft cartilage cushion in between. There are 4 ligaments in a knee joint mainly. 2 are on the outside and 2 are on the inside, which are known as cruciate ligaments. Cruciate is a cross, so it is a cross ligament. Most common injuries happen in a knee because this is the largest joint, and the most common injury to happen in a knee is a ACL ligament tear. Usually happens in young people, usually happens in sports person, usually happens in two-wheeler riders, and whenever there is a twisting injury, there is a chance of a ACL ligament tear. Main problem is that the ligament tear happens and most people do not realize. They think there is a sort of a soft tissue injury in the knee. Let's take some rest, some medication, ice pack, apply a crepe bandage and everything will be all right. The problem is when the ligament is deficient, then the ligament leads to an unstable knee. Even if symptoms are not arising in your knee joint, still the knee is unstable. So when the knee remains unstable, what happens? The wear and tear increases. Then the tear in the menisci, in the meniscus, that tends to happen and the tear does not heal, and then your knee sometimes gets locked or sometimes become arthritic in an early age. For example, if somebody has got a ACL tear at the age of 22 or 23, we expect a knee arthritis to happen early, maybe around 35-40 years of age, 45 years of age, as compared to if everything would have been all right, or if a ligament reconstruction happens, the person might get or might not get arthritis even at 70 years of age. So, for example, similar example is that when a tire is punctured of our car, we can fill up air in it, but we do not wait for the puncture to be repaired till the tire gets cut or totally deflated. Similar, whenever there is a ligament injury, it has to be reconstructed because it does not heal on its own, so that further damage to the meniscus is prevented. In a knee arthroscopy, very good thing is that it is a bloodless surgery, requires a very short stay, a 1-day stay in hospital. Maximum stitches are 3 to 5 stitches only, and the stitch removal happens in 10 days. The recovery period, the patient is allowed to walk the very next day in case of a ACL reconstruction, and the total recovery varies from 4 to 6 weeks completely. A patient can go back to driving a car in approximately 2 months of time. So, it is a good surgery to be done to prevent further knee damage in a ACL ligament deficient knee. So, that is my concern. The risks involved are very minor. Some stiffness in the knee might be there, some initial pain might be there on walking, but everything settles down approximately 10 to 12 days. So, this is a good surgery. The risk of infection is very less as compared to any other thing. We are taking all precautions at Manipal Hospital, and we have a very low risk of infection for any kind of surgery at our place. So, my recommendation is that if you have a ACL tear, if you have a meniscus tear, please do not delay it. Reach to an orthopedic surgeon. We have a very good team here at Manipal Hospitals. You can come to us if you want to. We will consult, we will give you an opinion, and I hope we will give you a good cure. Thank you.